In the first few episodes of the Man Up Malaysia podcast series, we focused on issues like erectile dysfunction, low sex drive, and male infertility. And somewhere in there was talk about hormonal imbalance. And for men like me, the only hormone I know is testosterone. But what do I know about testosterone? How does it work? Are there any other male hormones? How can we make sure that we have enough of these hormones? A lot of questions in my mind, so I thought for the answers, I need to speak to someone who knows a lot about it. My guest today graduated from Melaka Manipal Medical College in 2006 and was posted in Hospital Seri Manjung, where she completed her housemanship training and went on to become an MO in anesthesiology. In 2008, she transferred to HKL, where she completed 4 years as an MO in neurosurgery, upon which she joined her father, Dr. Genga, at Kelinik Genga, being guided in the principles of alternative and complementary medicine. She's a firm believer in holistic care and a special interest in knee osteoarthritis, where she's a patent holder for a knee strap which is used in a clinic for knee pain and is currently in partnership with University Malaya to study its efficacy, preliminary results of which show promising results. She's also founder of her own natural skincare line, Noosh Naturals. Today, she talks to us about male hormones. If you're ready, it's time to man up with Dr. Anusha Nair. Dr. Anusha, welcome to Man Up Malaysia. How are you?
I'm very good. Thank you so much for having me. It's really exciting to be here and talking about especially men's health. I think it's a very neglected topic, so it's nice that you're doing this.
Yeah, just by doing all these podcast episodes, I've been learning a lot about how our body functions. And now that I'm past 40, I wish I knew a lot of this stuff so that I can advise my younger self. So I hope men listening to this can learn a lot and also take some of this advice and implement them in their lives for a healthier future, maybe. Now, today we're going to talk about male hormones. You know, if we just Googled hormones, there's lots of articles and information about women's hormones. And if a woman has a change of mood, we sometimes say it's just her hormones, right? But when men have a bad day, we don't say it's his hormones, right? We probably say it's something to do with stress or something like that. Why is that, Dr. Anu?
Men, it's a little simpler. At least you don't have progesterone and estrogen and oxytocin and prolactin, which are extra hormones that females have.
Okay, so probably that's why we have more articles on hormones relating to women.
Of course, female hormones are more cyclic. They're different, but male hormones are equally as important because you need to get to tango, basically. I think the education and the information available is also kind of like scarce and bits and pieces in terms of men and hormonal health. I think it's very, very important for men especially to realize what are male hormones, what is it about, when, and don't, sometimes they try and supplement themselves with hormones for certain things, willy-nilly. I mean, all those kind of things should be done with a good education, with some good guidance, to see if you need it, you don't need it, and all the appropriate measures have to be taken before you jump into just haphazardly treating hormones, especially for men. Yeah.
And talking about stuff that men don't know, I mean, is there such a thing as male menopause?
Yes. Okay. So that's a good one because there is something called male menopause or andropause. So of course it's something a lot of men don't like to talk about because there's this stigma in men that they have to remain virile until they are 70 and they can father children in their 80s. They're forever potent.
Mick Jagger did it at 73.
Yeah. So that definitely is true for certain men, but it is also scientifically proven that there is something called andropause, which means that it's not a sharp decline as you would have in females, but a sort of gradual decline in the hormones in men as they approach their 40s and onwards. So there's some studies that show that there's at least that there's an average of 1% decline per year, as you age. Of course, it varies depending on your health, your diet, your lifestyle. But technically, men don't have a cut-off as per women, and their range of andropause is very variable from one person to the other, which makes it another thing which is quite ambiguous. And it can happen in your 60s or 70s or 40s even. So yeah, I think that's something to actually acknowledge, that there is something sort of called andropause, which is a gradual decline of testosterone as men age.
And would this be considered hormonal imbalance, the decline of androgen?
So it is actually a natural process that takes place. So a gradual decline is part and parcel of aging. However, it can become a hormonal imbalance if it starts affecting you adversely. For example, certain men are trying to conceive, and they find at that point that they have poor sperm count, or they have difficulty having an erection, and they have low libidos. Or if they have, as they go older, they can have bone demineralization, they can have very bad fatigue, sometimes hot flushes. So if it is starting to affect your daily life, and then it is definitely something that you have to tackle, in terms of it is become a hormonal imbalance in that way that you have to treat it.
Androgen and testosterone, are the two the same?
Well, they come under the same category of basically androgen. Androgens are basically hormones in the body which kind of exert an androgenic effect on men. Androgenic effect meaning that it causes the similar effects of muscle bulking, making your bones heavier. But the main one, of course, is testosterone, and there are a few others. Testosterone is basically the main hormone, and there are other hormones like dihydrotestosterone sulfate. These are minor hormones. They also create an androgenic effect on the body. Of course, more studies have been done on exactly how they work, but they found that testosterone and these androgen hormones, which are the minor hormones, dihydrotestosterone sulfate, also create an androgenic effect. Basically on bones, on muscle mass, on facial hair growth, all the male characteristics, they basically enhance those.
The male puberty, lah. Am I right?
Yes, so all those hormones will be raging lah that time. but it needs to also maintain its levels, you see. So yeah, so if those hormones decline as they age, then of course there will be effects as well.
Okay, Dr. Anu, so I didn't pay much attention in school, especially in biology class. So you have to give me a crash course on testosterone. How is it produced?
Testosterone, you can have testosterone. The main site of testosterone production is actually in the testicles. There are cells in your testicle called Sertoli cells or Leydig cells, and these cells are the ones that they respond actually to pituitary hormones called luteinizing hormones. And these luteinizing hormones, which are secreted from a gland in your brain, if testosterone levels come down, these hormones, which are secreted from those special pituitary cells, secrete LH, and luteinizing hormone then causes the Sertoli cells to create testosterone. So that's how testosterone works. And there's another gland as well, which are the adrenals. Adrenals are also part of your hormonal glandular structures in the body. So testosterone can also be produced in small amounts in the adrenals as well.
But what is still the average amount of testosterone that a man needs?
I think there is a variation between, of course, person to person, much variation, but there is a normal where it's 300 grams per deciliter, if I'm not mistaken. So if the hormones drop below that, then you would be classified as having low testosterone. So that is the cutoff point, and then you would be considered having low testosterone.
How do we find out what our testosterone level is?
Okay. So that's what your good old GP or urologist is for. So So if you're worried about your testosterone levels, there are a few blood tests that you can do. First and foremost, of course, you go to your doctor, you can explain your symptoms, explain why you're worried, why you think you might have low testosterone levels or whatever. And your doctor, of course, will decide what's the best method. Is that the only test they want to do, or do they want to add on other tests for you? But to test testosterone, there, of course, you do a blood test. In your blood test, you'll be tested on a few things. One is testosterone levels, serum testosterone. Then you would also be tested on how much FSH as well as LH in your bloodstream there is. Sometimes you would also be tested for something called prolactin, because in certain situations, if there is some decline in pituitary hormones, sometimes it could be due to a tumor, an adenoma. So some instances, then prolactin is also taken into account. And also for some people, if the doctor has the tests within their list of tests, it's also serum sex hormone binding globulin. So that means you might have enough testosterone, but if you don't have the globulin that binds the testosterone, you will also have symptoms of low testosterone because your body is not able to use that testosterone as well. So serum sex hormone binding globulin levels can also be checked. So you might be secreting enough testosterone, but if you don't have the binder hormone as well, then you would also possibly have symptoms. So these are the usual tests that you would do to check on hormonal balancing for men.
Wow, I never knew about the hormone binding globulin. I hope I'm saying that right. Now, if that can cause low testosterone, what are the symptoms of low T?
Sometimes it's very vague, but most men usually complain of fatigue, low sex drive, maybe erection not being adequate. You could have maybe poor sperm count, just general fatigue, moodiness, bone pain. I mean, the similar things, sometimes hot flushes. So similar things as what women go through in menopause, men go through the same thing. We're not so
Right.
different after all.
Yeah. We can't blame it on the football all the time.
No, you can't blame it on the football.
All right. So if I go for a test and I find out that I have low testosterone, then how do we treat it?
All right. Well, the treatment now that is depends on what age you are, your basic general health and well-being, of course, and what are the treatment goals basically. So if somebody were in their, let's say, early 40s, 50s, and they are trying to have a baby, and at this point we find out that they don't have enough testosterone, which could be one of the reasons for poor sperm count, low mood, low libido, and maybe erectile dysfunction. Those could all be attributed to a low testosterone level. However, because the goal here is actually to have a baby, then sometimes supplementing testosterone at this point is not the best solution, because as much as treatment with testosterone, as in just giving the patient back testosterone in terms of oral medication, either injectables, or they can have sprays or creams, or in whatever modality we want to replace the testosterone, that will not give the patient back his sperm counts and sperm motility, because for that to take place, the body actually has to produce more luteinizing hormones. So when you give testosterone, the pituitary actually is then suppressed in secreting the other hormone, actually for the maturation of the sperm cells as well.
Are you
Yeah.
talking about testosterone replacement therapy? Is that
Correct.
what this is?
That's right. That's
Oh.
right. So that's the thing about testosterone replacement therapy, is that if you're trying to start a family, then testosterone replacement therapy shouldn't be administered straight away. Of course, you should see a urologist to discuss the best methods of going forward. But at that point, testosterone therapy is not the first line of treatment. As you get older, of course, that can be incorporated. So if you're not planning to have a family, you basically are, in your 60s or 70s, you find a general decline in mood, decline in your, your libido, and you want to improve that kind of your well-being in that way, then at that point maybe supplementation of testosterone is a viable option.
Now, before the show, we've been talking about your clinic, Kelinik Genga, and how it includes natural therapy or natural remedies. How would you treat this one naturally?
So the thing is now, when you talk about testosterone, low testosterone, it doesn't just happen out of the blue. There is a reason for why it's there in the first place. So the reason being that the body is in a very finite balance at all times. And usually if our diet, our lifestyle, our food habits, if our general physiology is not conducive or is kind of causing us to have a lot of stress. So if you have a lot of stress in your workplace, you're not getting enough sleep, what happens is that there is an increase of adrenaline in your body. There is an increase in cortisol. There is an increase in stress hormones. And at that time, the body is not going to be focusing on reproduction. The body is going to be focusing on managing its stress. So this stress over an extended period of time then can actually cause men to actually have hormonal imbalances and low testosterone due to that. So managing your stress is extremely important, making sure you get at least 8 hours of sleep. The second thing is, of course, a diet which is nutritious. So, the mama lifestyle, the fast food lifestyle, that really plays a big role in our health as well. Our body requires a lot of energy to create sperm cells, mitosis, cell replication. These are all very energy rich, enzyme rich reactions and that need to take place. So if you're not supplying your body with the right fuel, those reactions then cannot carry forward. So again, going back into diet, lifestyle, really important. Increasing your fresh fruits, veggies, antioxidants, getting enough sleep. All these are really vital. So you have to, it's always a two-way street. There's always a reason for why you get sick or why certain things are manifesting in your body, and going back to why it's happening is always vital. So having somebody to guide you and kind of say, okay, this is where you're going wrong, this is where you're going wrong, and then say, okay, you need to get this amount of sleep, this is where your screen time has to reduce or whatever. So those are the important things. Those are the two. And then of course, to help speed up the process, the next thing is of course diet and lifestyle. So that means exercise. So if you're more on the obese side, if you're more you have type 2 diabetes, you have hypercholesterolemia, these are all again metabolic syndrome. So when your body is in a metabolic syndrome, this is something called starvation in the midst of plenty. That means the body itself is in sort of a starvation state. So when your body is in a starvation state, again, it's going to conserve energy, it's going to divert energy away from reproduction to maintenance of your system. In a more complementary or holistic standpoint, we go full force into correcting the patient's diet and lifestyle. We're really strict that if you want to get better, that these are the methods that you need to do first and foremost, and then only resort to medication or whatever supplementations subsequently. So we guide our patients in terms of how they can change their diet and lifestyle and get more active, and what exercises to start on with and things like that. And of course, we do have a therapy that basically deals with helping the pituitary function better. So it's basically electrical pulse stimulation that helps boost more circulation into the whole body, as well as just helps the pituitary function a little bit. Of course, this is not hard science. This is a complementary therapy that we've been practicing. So we find that our patients respond well. They sleep better. They're less fatigued, and that is actually the first step in terms of overcoming the whole issue in the first place.
Is that from a machine, this therapy?
Yeah. Yes, it's basically just like little buttons that we stick onto the skin, and then we use electrical pulse stimulators to direct those pulses onto certain areas which are related to the physiological response we want to create, to basically overall boost circulation, boost metabolism, and boost neurological health.
This would not be a one-off thing, right? I mean, you would have to do it consistently, maybe for a few weeks.
No, we have a 1 month program usually that people go through. So they go through 1 month of treatment with us, as well as if we find that they need certain supplementations. So sometimes we will also supplement them with certain herbs that are beneficial as well. Things that we normally add on are things like herbs like ashwagandha, Ashwagandha is a really good herb actually for in terms of managing hormonal stress, whether it be from men or women. It balances thyroid hormones function, it balances melatonin levels, it balances the stress levels. So people find they're less stressed, they're able to sleep better, they're able to wind down better, they're not so tense all the time, their serotonin, dopamine levels go up. So the happy hormones are better than the stress hormones. So all of those things are very important. And then sometimes we also need to boost the FSH function, help with libido. And then we usually add on other herbs like things like gokshura. These are all traditional Ayurvedic herbs which are used for increasing men's libido, increasing sexual wellness, and increasing sperm count. So those are just simple little herbs that we usually add on in with our therapies as well. So that in the end of the day, we don't want patients to depend on our method. We don't want them to be dependent on us for therapies. We want them to be able to just get over the hump and then maintain from there on. So the therapies that we use as well as the herbs are basically to get over the hump, and then after that the maintenance, once they're into a better lifestyle, into a better diet, and they can maintain it, then they're in for a long run, that they will have a better outcome overall.
So this therapy, part of it would be Ayurvedic therapy. Am I right?
Yeah, yes, it's an amalgamated approach.
Now, talking about all these lifestyle modifications and
Yeah.
supplementing with all these herbal remedies, there's
Yeah.
also other influences that can disrupt the hormones, right? So maybe you can talk a bit about endocrine disruptors.
Okay.
So,
Oh, endocrine disruptors. Okay,
yeah.
so in terms of endocrine disruptors, of course, the usual drugs of choice are always the endocrine disruptors. Smoking, alcohol are major hormonal disturbances. They cause hormonal disturbances. They definitely cause a decrease in testosterone production from the testes as well, because it has an oxidative stress effect on the system as well. Now, if you're talking about like the other endocrine disruptors, you're talking like BPA, these additives in our body care preparations, in all those other things, those are little chemicals, phytoestrogens. These are basically synthesized man-made molecules, whether it be in fertilizers, in pesticides, or in chemicals that we use on our body, also preservatives in food that can mimic hormones in our body. And these chemicals, because they are basically aromatic hydrocarbons, and our hormones are also aromatic hydrocarbons. So when they are able to kind of disturb the hormones by having a small chemical reaction with those hormones, that's what we call hormone disruptors, in that our hormones are not able to work as well if these substances were to enter our system in large amounts.
And this substance can also enter our system through plastics, right? There's a lot of
Of
talk
course.
about putting food in plastics and all that.
Yes, yes. So that's why the BPA in plastics and things like that. There are many plastic components that have been kind of linked to disrupting hormone because they are aromatic hydrocarbon compounds. And these compounds, if entered in the system, can mimic our hormones as well, and that is the whole issue. So, and the crazy thing is that these plastics are also in things like your creams, your lotions, your deodorants, your hair products. They're in every of these little things. So, and our skin being the biggest organ is also able to absorb these substances. So, of course, having a BPA-free mineral bottle, or drinking from using less plastic in your food containers, as well as trying to reduce these substances in your skincare as well, is I think quite important. That's one of the reasons why I actually have my own skincare line.
Yes, I wanted to talk about your skincare line, but I guess we'll have to do it on another show because it's a very broad topic and it's a topic that you're passionate about. So, Dr. Anusha, until you come back again, can you leave us with some advice, especially for men experiencing some sort of hormonal imbalance, maybe erectile dysfunction, low moods, or even fatigue? What's your advice for them?
I think the most important thing is that it shouldn't be a taboo topic anymore. I think society has evolved to equality, meaning that as much as women are able to talk about their issues, men should be able to talk about their issues openly and freely without judgment, especially from other men. So there is nothing wrong with having a medical issue. It is not something you can, it's out of your control at some points. But first and foremost, especially when it comes to more sensitive topics like sexual health and hormonal health, I think being able to discuss it with your friends or your partner or your doctor is very important. You don't have to suffer by yourself. These are treatable issues, but the first thing to being able to treat your issue is that you come to terms with it, you be open about it, you can then move towards solving it. So it's 2020 and there's a lot of options now available. So don't feel isolated and alone. I think there are many healthcare professionals now, also like you, Kevin, very, very wonderful that you're bringing this out into the open so that other men can also benefit and not suffer in silence.
Thank you. Thank you so much. That's exactly the mission and ambition of Man Up
Yes.
Malaysia. So,
Yeah.
Dr. Anusha, thank you for your time. Thank you for sharing all about hormonal imbalance and what we can do. And like I said, hopefully we'll have you back on the show to talk about other topics that's close to your
Yes.
heart.
Okay, great. Thank you so much, Kevin.
That was Dr. Anusha Nair from Kelinik Genga talking to us about male hormones. At Men Up Malaysia, we like to encourage men to make small changes. And as men, we always like goals and targets. So we have a health pledge for you to download. Make a pledge and stay accountable to yourself. Just make a small change, like maybe improving your diet, or doing more exercise, or even going for a check or screening for whatever it is, maybe a prostate check or just a general health check. Just make the health pledge and also stay accountable to it. It's time for us to get healthy, and we can do it one pledge at a time. More details at manupmalaysia.com. But right now, if you found this information helpful, please help us share this video, give it a like, or even subscribe to our channel and hit the notification bell to get alerted when we have a new episode out on Man Up Malaysia. Thanks for watching or listening. I'm Kevin Francis for Man Up Malaysia, helping men get healthier one pledge at a time.